Dr. Anthony Bella is here, who is a urologic surgeon, amongst other things, at Ottawa Hospital, and a teacher of such procedures and so on, and world-renowned. Welcome to the show.
Thank you, Kurt. Appreciate it.
We're going to talk about a pretty sensitive subject right now, and many of you at home might know of or been through prostate cancer. But it's the after effects of prostate cancer that we're going to really concentrate on today. First of all, we're having great success in dealing with prostate cancer itself, correct?
We are, absolutely. Compared to 10 and 15 years ago, we know that the survival is going to be 25, 30 years for most men. The treatments are better. There's less collateral damage. But with that comes a bit of a cost, because if you're around for 20 years,
yes,
and you have side effects because of the treatment, well, those interrupt your quality of life. They disrupt what happens at home.
What kind of side effects are we talking about?
Really, for prostate cancer treated men, we're talking about urinary control, so leaking. You can't control your pee, so you're scooting to the washroom, or you're leaking in your pants.
Or you're wearing some protection under your pants.
Absolutely. There's a lot of guys out there who are wearing diapers still after their treatment 4, 5, 6 years later, and we have good treatments that are safe and effective that they're simply not accessing.
Right.
The other side of things are a guy's hydraulics, erectile function.
Right. It's diminished or non-existent?
Or non-existent, and we don't have the equivalent of Angelina Jolie to talk about these things.
And that's part of the problem that you've discovered, and there's a survey, a nationwide survey that has been looking at this issue. Part of the problem, I guess, from what you've been telling me, is that men are somewhat afraid to take the next step after the surgical procedures and after, beating cancer, per se. They're worried about more surgeries and more intrusion into their lives, but it might, in fact, improve the quality of their life.
Absolutely. The steps to recovery include not only dealing with the cancer and your PSA testing, but it also includes getting your life back, getting as close as to how you were before surgery. And things aren't the way they used to be. We've advanced so far along. If you need surgery, which is rare, it's minimally invasive, it's the kind of in and out surgery. Rates of success are over 95%, but does a guy really want to have another procedure down below? That's a tough question.
Well, and is that the issue with most guys? They just don't want to go through this again?
You know, there's an emotional component, there's that component of with their partners, but that's it. Having another surgery, having another procedure, not really understanding what's out there. Is it going to be something that's going to be worse than what they're starting with now? And simply, that's not the case.
I guess it's the way you look at it, but to me, and I've not had prostate cancer, I don't know. But to me, if you go through that, getting some quality of life back and being able to walk around without a diaper on and be able to have sex and enjoy that as well after the fact is almost to a lot of guys as important as beating the cancer itself, don't you think?
It is, and that's what this new study showed is the fact that for some reason in Canada you still have 40 or 50% of guys who are leaking or who don't have their function back, who simply aren't talking to their doctors. They're not getting access to the kind of care that's really available in Canada.
So they beat cancer with the help of their doctors, their nurses, all of those things. And that's where it ends for some guys?
So the cancer care journey, if we think about breast cancer, for example, includes the treatment of the breast cancer, the follow-up, and for a lot of women, breast reconstruction.
Reconstruction. Sometimes full-on reconstruction.
Absolutely. For a guy, you have your prostate cancer treatment, you go through the cancer care journey, but sometimes that does stop at the leakage part. It stops at the, I don't have my erections anymore.
So that's it?
Well, it shouldn't be.
I know, but for a lot of guys, that is it. We're sitting here with one of the people on this planet who actually teach others, and you've just returned from doing stuff like this. You teach other surgeons around the world how to perform these operations that can help with those issues.
We're lucky here in Ottawa. We have world-class expertise for the complications of the collateral damage of prostate cancer. For me, it's on the hydraulics or the erectile function side. We have Ron Garazin and Eric Saltel who'll deal with the urinary incontinence here in Ottawa. And we get to go and teach our colleagues how to do this.
I want to, I know we're running out of time, but I want to show a couple of things that you brought along, and these are some of the things that the equipment that helps your equipment, fellas. This is what we're talking about here. What's this thing?
So let's show this one first.
Okay,
so when somebody thought about a penile implant back in the day, it was basically two little rods that went in the penis.
Right. So a prop, a popsicle stick.
That's about it. And this is where I understand why guys would be hesitant to talk to their doc, to talk to their partner.
That'll scare the crap out of you right there.
Absolutely. But really what it is now, it's an internal pump.
Right.
Nothing you see, it's all internal.
Nothing outside.
Absolutely not. So what you have is you have 2 cylinders that go into your penis. So you
Right.
have 2 chambers in there, they just slide in.
Right.
This holds the fluid that's going to allow the penis to go up and down.
Right.
And then you have a little pump that's in your scrotum. It's like a third little
Inside.
testicle inside.
You
and all
just
do,
pump that up and away you go.
And away you go.
Same feeling, same.
The sensation is excellent
Sensations.
because we don't operate where the nerves are.
Right. Here's another. This is for those who have leakage issues and so on.
Right, so about 1% of men who undergo prostate cancer surgery will not get any urinary control back.
Right.
So this is an artificial urinary sphincter. All you end up doing when you need to empty the bladder, where you need to go have a leak, is to
Right.
press the button.
Press this button.
This button here.
This one here,
which
it's
goes in the
inside?
scrotum. It's in the scrotum, it's in the sac. And all that happens is it opens up the pee passage, and then it closes on its own.
Right.
And now you're not in a diaper, and now you have your quality of life back.
The bottom line to all of this is, after the fact, after you've beaten that monster called cancer, there is help available. You just have to seek it out or have someone push you in that direction.
Cancer survivorship's the buzzword now. In reality, it means get your life back, get your quality of life back.
How do we find out more information, doctor?
There are a lot of websites out there that have good information. There's edcure.org, there's smsna.org, or the best one for the erectile function side of things is sexhealthmatters.org.
You know, and you know it's a scary topic for a lot of fellas, and we all know that, but if you want some quality of life back, there's a good chance you can have it, and that's the main message I think you bring today. Thanks for your time.
You're very
I
welcome.
appreciate it.
Much
Dr.
appreciated.
Anthony Bella is here, and he's a world leader and we have doctors and medical people here in this city who are leading the way.
I'd like to give you your new keychain.
My keychain. What is on my keychain?
So that's the way we teach a man on how to use the pump in the scrotum. So it is a facsimile or a practice pump.
Right. Listen, you never know, right?